This week, the Illinois Department of Public Health is sending out an alert about possible fake Botox following the hospitalization of two people right in LaSalle County. And joining me now to talk about what everyone out there needs to know about the safety measures needed behind these types of procedures is Dr. Aku Dolan. Thank you so much for being with us.
Thank you very much for having me.
Now, doctor, I know you're a plastic surgeon with Northwestern Medicine in Huntley, and I must tell you, it seems like everywhere on social media, Instagram, people are advertising that they do Botox, which we know can be really scary because that doesn't mean that they're qualified. What kind of questions should someone be asking before they go out and find someone to do Botox on them?
Of course, yeah, you're completely right about there's a huge advertisement, especially on social media. There are multiple training going over. But as a plastic surgeon, and what we do in NM, so anybody working in a hospital setting, their privileges, their credentialing is already verified. And for any patient who goes to any place to get any medical related treatment, I recommend them to independently verify their provider. So they can either use, for example, for plastic surgery, they can use the American Board of Plastic Surgery website. You just type your provider's name, and then if you see their name there, perfect. It means they are plastic surgeon and board certified. Or you can go to state medical license and then check your provider's name there and then see that they are registered and licensed. And you can also see if they had any discipline issues or any problems in the state website as well.
You know, it's really interesting to see how Botox has evolved. At one point, we used to talk about older women specifically getting Botox, but now it seems that it's crossing all ages in terms of even young adults going as far as to get Botox. What can you tell us in terms of symptoms? Are there symptoms after getting Botox that something might actually be wrong?
So the Paracelsus, the father of toxicology, said that dose makes the poison. So botulinum toxin is a toxin, neurotoxin, made by Clostridium botulinum, which is a toxin and which is one of the most potent and lethal toxin in the world. But the companies purify those, and then they dilute highly, so the effect is local in the muscle where it is injected, rather than causing those systemic symptoms that we may see. So most of the complication, any product produced by reputable company and which is FDA approved, we don't see much complications or lethal complications related to toxin. Most of the complication that we may see, if we see anything, could be droopiness of upper eyelid or facial asymmetry. But the things that we are discussing are the symptoms of the botulism that was seen in the past. Like, I have been in the medical field for 20 years. I didn't see any botulism case.
Okay, well, doctor, we appreciate you coming on. I know it's a topic we can continue to talk about. Unfortunately, we've run out of time, but we appreciate you coming on and letting us know some of the safety tips for people. Thank you so much for being with us.
Okay, thank you very much.